Chapter 38, we're going to talk about respiratory drugs, including antihistamines, expectorants, suppressants, mucolytics. I will skip through the review questions for NCLEX. You can see those, and we'll likely discuss those in class. A simple review of the upper respiratory tract anatomy. Keep in mind what it does and the parts that are included. Our nasal cavity and much of our respiratory upper tract is about warming and humidifying, cleaning that incoming air. A lot of the reasons for like nasal hair and that kind of thing is to do just that. It is a very vascular area, so it is a good place for drugs to be applied directly and have a very quick effect with limited systemic effects on and side effects for the rest of the body. It is controlled by the autonomic nervous system. So as we talked last week in class about the sympathetic and parasympathetic nervous system, it's important to review some of those characteristics of what happens when those are engaged and the effects that it has on the respiratory tract specifically. If you remember, the sympathetic nervous system is that which is about fight or flight. And in general, what's going to happen in the respiratory system is we're going to see bronchodilation. And again, if you remember why that happens, our body is in that fight or flight kind of mode. And as it requires oxygen to basically put up that fight, it's going to respond by making our body more able to take in more oxygen by expanding or dilating those bronchial passages. Likewise, on the other side of that, the parasympathetic is going to be more about bronchial constriction and making those passages not as large because there isn't the need there, the demand for oxygen in the body. The upper respiratory tract is going to be about keeping out pathogens, basically a protective measure, first line attack for the lower respiratory system. We also have a fair amount of mucosa, which lines that respiratory system. It again is a protective measure. However, it can also present problems when it's in excess. We have nasal mucosa. We also have mast cells, which are often the cells that are triggered when we talk about things such as allergic rhinitis and cause some of the problems. But it is basically there as a mechanism to help protect us from keeping in any foreign bodies. Allergic rhinitis is kind of a fancy name for what we call allergies, and creates inflammation of that nasal mucosa. It also creates a histamine release. Histamine is basically what's released in response to a foreign body or an allergen, antigen, and keep in mind that a lot of the most common allergens are going to be environmental kinds of things that are seasonal. There's also a very likely family genetic kinds of predisposition for allergies. So you're going to see those kind of things run in families. These often go hand in hand with the next chapter we're going to talk about with asthmatic things. Some are going to be seasonal, others are going to be what we call perennial, meaning all the time. They're basically available all the time. such as dust or animal dander or mold. The other thing that you have to take into account is also food allergies, and that's a fairly common thing as well. We see certain things be much more likely to be an allergic response when we start talking in pediatrics. We tell parents to avoid things like chocolate and strawberries. Eggs are a common allergy, as well as peanuts, and peanuts has really become a huge one that's come to mind in the last few years. Histamine is basically the chemical that's going to be released when we create that inflammatory response when it comes into contact with an allergen. We have two kinds of histamine that are going to be released depending on where we're talking about. We've got H1 receptors that are going to be most commonly thought of in the respiratory tract. When we talk about the other type of histamine receptors, we're talking about those that are going to be found more in the digestive tract and deal more in that area. Intranasal glucocorticosteroids are really a great way to address some of the allergens because, again, when we apply a drug directly at the site that there's the issue, it tends to have a much more immediate effect, and it also tends to have far fewer systemic effects. It goes basically straight to the target area. This is more in anticipation, so I have to have, as someone using this, a pretty good margin of time. 2 to 3 weeks is what your book talks about prior to being exposed to that allergy. So you can see where this would be very effective in dealing with seasonal allergies, particularly if we know that there's a time of year that they're going to be most prevalent. So those drugs can be introduced at that point. This is the glucocorticosteroids decrease the secretion of that inflammatory mediator. So you're going to see less inflammation, less edema, less mucus production, and also create a basic mild vasoconstriction, which is going to, again, reduce that inflammation in that immediate area, in this case, the nasal passages. These are considered a first line as far as treatment for allergic rhinitis because, again, they are preventative in nature, or you're also going to see the word prophylactic. So they're an ongoing, can be introduced prior to that allergen being introduced. The other thing to consider is some of the side effects. They are going to be most frequently intense burning sensation in the nose immediately after that is applied, and excessive drying. The alternative is this cromolyn, which is listed here, because it's also going to inhibit the histamine from mast cells. So it's going to basically stabilize those mast cells. It's going to keep them from secreting that histamine. Again, this is a drug that's given prior to exposure and more preventative in nature. Your prototype drug for this area is, and I'm not going to say this very well, we're going to go with Flonase. And again, you have to understand when this needs to be applied. Swallowing sometimes can cause them to have more side effects because that's going to create more of a systemic reaction. But again, this is one of those first line kind of meds that we're going to see used in the treatment. Here are all your drugs in this category. Again, Flonase is going to be the prototype. If you look for that purple circle next to it, that's going to indicate to you which one, when we're talking about categories of drugs, which drug will be the prototype drug, so you can find that very readily. Intranasal and orosympathomimetics. Again, when you break down that word, sympathomimetics, that is basically mimicking that sympathetic nervous system response. So it's going to create that dilation of the bronchioles and create a better airway movement. These are going to be used often with nasal congestion, such as with the common cold or again with allergies. But again, also have fewer side effects because most of the drug is going to happen right at the site. Your prototype drug for this is Afrin, and the biggest side effect that you're going to see from this is folks that get what's called a rebound congestion. And that basically is once that drug wears off, you almost get a more pronounced release of that congestion and mucus. And so it's recommended that these drugs only be used for 3 to 5 days. What happens when folks continue to use it past that recommended time frame is they become a tolerance and require it in order to become not congested. And so they literally have to be weaned off it by use of the intranasal corticosteroids so they won't get that rebound congestion. That's a highlighted word in your text, so you can usually pretty well know that that's going to be a term that you need to use. These can be taken orally, and when that occurs, you don't have any of that rebound congestion, but you also have a higher likelihood of systemic adverse effects. These are going to often be things like hypertension and just overall stimulation. And again, when you look at the fact that this is stimulating that sympathetic nervous system, those are all things that we see when we look at the sympathetic nervous system being kicked into gear. You're going to see blood pressure rise. You're going to see higher, usually, heart rates. And so, you see some of the side effects. Oftentimes, patients will complain of insomnia and anxiety again because they're kind of in that perpetual fight or flight kind of situation. Here again is your chart, so you can look through that. It's always going to list the route and dose and adverse effects that are going to be most common. Nasal irritation, burning, sneezing, dryness, headache. And again, that rebound congestion is one of the most common ones. I think if you try to remember that these are fall into a sympathomimetic, that'll help you remember some of those side effects. This slide is just basically restating some of the things that we've already talked about. Should be used sparingly for 3 to 5 days. Does have a nice immediate response in the area it's being affected with effects. Sweet. Pharmacotherapy of a cough. Remember that a cough, again, is one of our natural body mechanisms in order to protect us against any kind of foreign bodies. So when we cough, we're trying to get something out of the respiratory system. And generally, we have also the cilia, which are within the passageways that are going to help propel that foreign body out as well. As we look at young children and older adults, and young children, babies, and toddlers, those cilia are not as mature and don't work as well. We also have very narrow passageways. And, we talked about the bronchioles being like trees and branches of trees. And really, to make it in a very simple term, their trees are very, very small little branches. So it's very easy for things to get in there and get stuck, if you will. Likewise, their cilia isn't as effective. And when we look at the older population, what happens with them is that their cilia is aged, so it is far less effective at propelling anything out of there. Many times they've also basically damaged those cilia with things like smoking, so they aren't working as well just by nature of being damaged over the years by things that we've done to our body. Colds and allergies often create coughs. We talk about different medications to relieve those. One of those is going to be your antitussives, and you have a nice illustration in your paperwork that shows what those do. One of the most common antitussives, and one that's used as a prototype drug, is dextromethorphan, or otherwise known as Robitussin. This is a very effective drug. It basically acts on what we'll call the cough center, which is the medulla in your brain. So it does actually work directly on that area. If we have a really severe cough, other drugs that work in that area and often are combined with guaifenesin or Robitussin are going to be those like codeine, opioids. Codeine is one of the better drugs that works directly on that medulla to suppress a cough as well. Expectorants work in the way of basically, again, I expect something to come out. I expect it to come up. So they're going to increase some mucus secretion and make it thinner to basically allow it to really push that out, get it out of there. Whereas mucolytics break down that mucus molecule where it binds together to allow it to be more easily projected out, if you will. Guaifenesin is a very common drug. It's one that's used, it's very available over the counter in a generic fashion and is very effective at doing this. It's also a fairly safe drug if taken as directed, but it's also a drug that's become abused in recent years. It's taken in excess to produce basically the side effects that they call it robo-tripping. So most effective with dry, non-productive mucolytics. Mucolytics actually work to break down the mucus. If you look at the word, lytic is always going to be, or to lyse is basically to break something down. It's going to stop something from happening. I used the example in class and we talked about Lysol, which kills bacteria and viruses, and that's that same root word, okay? Um, Mucolytics are going to work to help thin some of that and break it down so that, again, it can be coughed up. So it's very effective at treating some of the symptoms that we're talking about. Cystic fibrosis is a genetic disorder that is inherited. It's a recessive trait. Cystic fibrosis creates, we think of it and hear about it more in the respiratory system, but it actually affects multiple systems. It basically, the root of the disease is it produces an excess amount of mucus. So again, we tend to see that often in the respiratory system, but you'll see cystic fibrosis also affect the digestive system and reproductive system. Chronic bronchitis is chronic by nature, more than 6 months, and is a inflammation of the bronchioles, which often, with the inflammatory process, is going to create edema and excess secretions. So anything that's in that category, this is going to be a perfect drug to use. Here are all the drugs that we've been talking about, prototype drugs, etc. And again, codeine being a great one. Codeine is a drug, though, that you want to be use special caution with, because obviously it does have some other side effects. It can create some nausea and vomiting, and constipation is a huge one. So if you have somebody who's already constipated, this is not a great drug for them. In excess, it can create confusion and dizziness. It is an opioid, but in general, when it's taken as an antitussive, the amount that's there is typically not enough to really produce some of those addictive and negative side effects that we think of. It can, however, you have to look at that as an opioid. It does create hypotension and bradycardia, respiratory depression. So if somebody is already in that situation, this would not be, again, a drug that we would want to use. H1 receptor antagonists. When you see the word antagonist, you automatically need to think about something that's basically not allowing something to work. An agonist is one that's going to help, where an antagonist is going to inhibit. So this is the H1 receptors, again, remember, are often in the respiratory system. So if I am inhibiting those H1 receptors, I'm basically keeping that histamine from being released. So we are in antihistamine. We have several generations of these drugs, and the most common one that you're going to think of in the first generation is Benadryl or diphenhydramine. It's going to block at the histamine level and used to treat many allergy and common cold symptoms. Benadryl is one of those drugs that we see used for a lot of other reasons, though, for its side effects. So it may, when we see this given to a patient, it may be given for its therapeutic effect as an antihistamine, or it may be used for one of its side effects. Diphenhydramine or Benadryl, the most common one that we know of, again, is a first-generation H1 antagonist. It does cause, and the biggest drawback to it, or benefit if you're giving it for this reason, is it does cause some significant drowsiness. And when we look at the second and third generations, that's one of the big things that we see as being alleviated. They tend to have far less sleepy effects. Ironically, in some folks, it can actually cause the absolute opposite effect and be a CNS stimulant and basically cause them issues like insomnia and some of the things just on the opposite. It's more common in kids, than adults, but it very much can occur. It does have anticholinergic effects such as dry mouth, tachycardia, and mild hypotension. So you have to, again, recognize that those may be issues and warn patients according to it. The second generation drugs, when we start looking at those, are going to include drugs like Allegra. And again, the biggest benefit is that we tend to see far less drowsiness as in the Benadryl drugs. So this is where drugs have, we see them developed and improved upon. We see second, third, and maybe even more generations of drugs. One of the other drugs that's very common in this category is Zyrtec, and we see a lot of commercials for that. And again, the big benefit is patients are able to take these during the day and not have some of those drowsiness effects that they do if they're taking Benadryl. This, just like the first generation, is going to block at the receptor level, but used to treat congestion, sneezing, and all those allergy symptoms. It is best if, as with a lot of drugs, it's often better to take these before anything happens. So you'll find that they're going to be most effective if they're taken basically to anticipate symptoms as opposed to once things are already started symptom-wise. Intranasal glucocorticosteroids, again, Flonase is going to be in that category. We talked about this previously, to decrease that inflammation at the local level. Far fewer systemic side effects, but very effective as treating right at the site for allergic kinds of symptoms in the nose. Decongestants are just what they say they are. They're used to basically relieve any congestion, whether it be in the nasal area or in the bronchial tubes themselves. Again, adverse effects if it's used in a local spray type of thing is that rebound congestion. And so you want to caution patients against using it for more than 3 to 5 days. Antitussives, your prototype drug is that dextromethorphan, acts in the medulla to inhibit that cough reflux. You're going to hear this, the kind of more layman term is going to be a suppressant. I'm trying to suppress a cough. Adverse effects, dizziness, drowsiness, some GI upset. Dextromethorphan is the prototype drug. Can cause some upset, and if it's taken, can have some really more pronounced side effects such as seizures and slurred speech and that kind of thing. This is another drug which can be abused in an over-the-counter fashion, so something to caution parents and kids about as far as they can take too much. Anybody receiving any kind of histamine therapy, we need to have a thorough health history, what type of triggers that they have recognized. They may require further testing in order to determine those, in which they're given basically a small amount of that to see what kind of reaction they have. Assessment is going to include baseline vital signs, particularly, especially pulse rate, rhythm, and respiratory status. Assess neurologic status and level of consciousness. CBC, liver enzymes, renal labs are going to be important. We need to know how well their bodies are going to be able to metabolize this. This becomes far more important in those that we might suspect or have a history with any kind of impairment or aged. We're also going to assess them for any kind of adverse side effects they may have had from other types of drugs they've taken over the years. And again, assessment of allergies is going to be critical here because we do have some significant allergies, particularly to codeine in many patients. Nursing diagnoses that are going to be most common: ineffective airway clearance, ineffective breathing pattern, disturbed sleep pattern, they're unable to sleep. Can be from adverse drug effects, but they also may be from the symptoms they're experiencing, and fatigue as a result of either the symptoms or side effects of the medications. Remember, when you're looking at nursing diagnosis, you're looking at abnormal data specifically for the respiratory area in this circumstance. So ineffective airway clearance may include such data as they are unable, feel like they're unable to breathe. They may complain of dyspnea, congestion. They may have abnormal lung sounds such as wheezing or rhonchi or crackles. And this would be data that would be really critical for us to gather. Other data that would be very important would be O2 sats as well as respiratory rate. So when you're looking at your patients, you need to look at that whole picture. Think about what other types of things would clue you in that this person might be having a respiratory issue, and what kind of data I would want to collect, such as the color of their skin or capillary refill. Disturbed sleep pattern may include particularly complaints, more subjective data, such as a patient may state that they're unable to sleep at night or have to sleep upright in a chair or those type of things. Deficient knowledge is always an issue, and you can pretty well suspect that almost every patient is going to have some of this, in which we need to educate them as far as how the drug should be taken, what the therapeutic effect we would anticipate, what common side effects they are to anticipate as well. Risk for injury: because many of these drugs are drowsy inducing, we have to educate patients on the risk that's involved with those. Risk for falls, and again, we look at our more susceptible populations as being at particular risk for these types of diagnoses. Planning is going to include relief of symptoms, and we always want them to have as few effects as possible. They're going to be able to verbalize to us the use of the drug, any side effects they may anticipate, and precautions they may want to take as they're using these drugs, for example, operating an automobile or machinery or that type of thing. We want them to be able to demonstrate proper self-administration of the medication, understand what a dose is, when they need to contact their doctor for further care. As we implement it, we're going to monitor for relief of those specific symptoms, which would include any of that data that we've collected earlier. Breath sounds, color, consistency of the sputum. Keep in mind, as we look at overproduction of mucus, that mucus is a perfect medium for bacteria to grow in. That's where bacteria loves to lay. And so as we see people with these symptoms, one of our big concerns is, although they're often allergy or virally based, is that they can in fact go on and be obtain or develop a secondary infection that can be very bacterial in nature. We have to be careful using some of these drugs with those with asthma or COPD. COPDers, remember, we don't want to suppress any kind of respiratory effort that they have, and some of these drugs are going to basically fall into that category. Patients who are receiving antihistamine therapy need a very thorough health history, because the nature of the drug is it can cause some changes in blood pressure. And so those who have a significant cardiovascular history, while it may not always affect it, the change in blood pressure can have the ability to affect other issues such as pulse rate and rhythm. So we need to assess thoroughly and know what other medications they're on. Likewise, many folks who have hyperthyroidism often have experiences of having increased heart rate and increased blood pressure. And so just like with our cardiovascular patients, that needs to be used with some great caution. One of the other side effects that we mentioned earlier and is listed in drug books is the likelihood that we can create some urinary retention in use of these drugs. So again, with those who have some renal and liver issues as far as processing the drug and excreting the drug, that needs to be taken into account. If we have someone that already has an issue with some urinary retention, the last thing we want to do is add to that. We want to monitor for vision changes because of the likelihood of blurred vision. Narrow angle glaucoma, it is used with caution as well because of some of these sight issues. Neurologic status, it can cause some dizziness, some slurred speech, and should be used in caution with anyone with any kind of seizure disorder. And again, renal toxicity, because we do excrete drugs through the kidneys, the fact that it has some urinary retention may cause some buildup in the system for those who are affected already. One of the side effects that is fairly common with some of the drugs in these categories is they can actually increase blood sugar. So when we talk about diabetic patients, it's important to use caution with them taking them. One of the other issues is many of these solutions contain a fair amount of sugar themselves, and there are some sugar-free options that are available to patients. The last thing that you want to talk about as far as why this affects diabetics is when diabetics have what we call sick days, it's a common issue that they will have an increased blood sugar. It'll throw their blood sugars off. So if we add all these factors and risk factors together, they can be at really high risk for developing some real high blood sugar issues, even to the point of diabetic ketoacidosis, which y'all haven't really learned about yet. The way this acts basically is the drugs can actually impede some of the insulin production and absorption of glucose. It also they also can have a tendency to cause glycogen to be broken down more frequently. So it's very important that they take these into consideration when using some of these drugs, not just antihistamines, but decongestants. Dry mouth, again, is a common side effect, so teaching should include making sure they're taking it with plenty of fluids. Many times, part of the reason that they're taking these drugs is because they have this really copious amount of mucus production, and they need to replace some of those fluids anyway. Any kind of other side effects, tachycardia, palpitations, any dyspnea, any problems that are severe, such as confusion, should be reported immediately. In evaluation, we're going to look at basically, was this relieving a lot of the symptoms that we diagnosed in the first place? So nasal congestion and drainage. Are they breathing easier? Are they expectoring this mucus? Do they have some thinner secretions? and are their breath sounds clearer? And hopefully we're doing this all while having fewer side effects or minimal side. Cold relief, colds are one of the most aggravating things. We all know that there is no cure for the cold. However, we are trying to relieve as many of their symptoms as we can in the process. So assessment is going to include the basic stuff that we've talked about already, but again, assessment for any kind of adverse effects and previous history of problems with drugs that would be addressed in relieving symptoms. Here are similar nursing diagnoses that we've talked about already. Planning, we want them to have therapeutic effect and basically feel better and have relief from their symptoms. And understand how to use the drugs properly and to have a minimal amount of side effects as a result, and take it in a safe manner. We're going to monitor for any kind of side effects they may have. We also want to see that there's a therapeutic effect going on, looking at the color and consistency of any kind of sputum to look for secondary bacterial infection, seeing whether or not they have any of the common side effects in the GI system, such as nausea and vomiting. Again, some of the same types of issues here as we've talked about already. It bears repeating again with diabetics. We want to monitor their serum glucose levels to make sure that those aren't being adversely affected. Many of these patients are monitoring their own blood sugars at home, and so we want them to keep an accurate diary of what those blood sugars are, particularly on days that they're not feeling well. Side effects continue to be what we want to monitor for, and hopefully give them some strategies for preventing some of that. Sometimes hard candy with those that have dry mouth is a good one too, so that might be something that you recommend. With nasal drainage, something that also tends to be an issue can be a sore throat as a result for that. So there may be some other things that we look at. One thing you want to take some particular caution about is when patients are taking drugs, that they're not taking multiple drugs that they need to be looking at the ingredients so that they're not basically compounding the effect. We also want to caution anyone taking these types of drugs against the use of alcohol, since that can really compound the effect of the drug.